Chilean experience in telerehabilitation of patients with pelvic floor dysfunction in the context of the COVID-19 pandemic. Bernardita Fuentes, Verónica Aliaga, Carmen Abarca, Vicente Pizarro, Departamento de Kinesiología de la Universidad de Chile. I have no conflict of interest to declare. The current COVID-19 pandemic has forced the restriction of physical therapy face-to-face care. The telerehabilitation has been shown to be effective and safe in different areas of the physical therapy. However, experience in the pelvic floor rehabilitation is still limited. The goal of this study is to report the experience of physiotherapy specialized in pelvic floor rehabilitation in the management of patients with pelvic floor dysfunction remotely during the pandemic between May and September 2020. A cross-sectional, quantitative and descriptive study was carried out with combined sampling using a structured and self-administered online survey as an instrument. For the analysis, we considered PT who had performed at least 20 telemedicine attention. The analysis was done with descriptive and analytical statistics, and the study followed the indication for the International Ethical Guidelines for Health-Related Research with Human Beings and was approved by the Ethical Committee of our university. 273 PT were invited to respond to the survey. We received 190 responses, of which 53 meet the inclusion criteria, constituting 27.9% to the answer survey who used telerehabilitation during the period study. 51% of them were under 35 years old, and majority, 70%, work in the private health system. Of the total sample, 53% performed more than 50 remote care consulting during the period study. In this graphic, we can see that the most frequent attendant diagnosis was urinary incontinence, followed by the postpartum perineal recovery. But other types of the pelvic floor dysfunction were also treated with telerehabilitation. Most physiotherapy use more than one virtual communication method, including emails, WhatsApp, tutorial video conference, phone call, and other apps. The most used resource was video conference. 79.6% used this method through free platforms like Zoom or Google Meet. The second to most uses was video call by WhatsApp. Only 5.7% used platforms specialized in telemedicine. In the survey, participants were present with a series of alternatives regarding the advantage or benefits and disadvantage or barriers which they perceive with this modality of care both for the patient or user or for them as therapists, having to respond if they totally disagree or strongly agree. As shown in this graph, they were highlighted as advantage or benefit for patients by more than 70% of those surveyed, the delivery in timely care, a lower cost of treatment, facilitating access to the rehabilitation and shortening distance. In addition, greater autonomy for the patient, greater adherence and commitment, and good therapeutic result. As disadvantage or barriers for patients, it was highlighted by 75% of responders a technological gap. Between 50 and 60 of the PT survey agree or strongly agree was a disadvantage or barrier for was body coordination and proprioception problem, lack of privacy and adequate physical space, and lack of credibility and trust in remote method. When asked about the perception of the advantage or benefits for them as therapists, which we see in this graph, more than 70% of those surveyed agree or strongly agree that the benefits were delivering timely care, prevent exposure to the virus, and incorporation of a new therapeutic tools and the possibility to continue to work. Among the barriers or disadvantages, the main one highlighted by 90% of the respondents was not being able to perform the physical examination. Among other disadvantages, More than 70% highlighted the limitation of therapeutic tools and the lack of the protocols in telerehabilitation. Lack of training, information, and communication technology, poor connectivity was highlighted by approx 60% of the survey. The patient-therapist relationship was not reported as an advantage, neither for the therapist or for the patient. According to the opinion of the professional survey, the clinical diagnosis and the type of patient are the most important factor for achieving successful therapy, above the type of virtual communication used. As a conclusion, we were able to observe that a low proportion of the responding PT used telerehabilitation during the period study. The reported experience showed more advantage than disadvantage for user and for therapists. Telerehabilitation is a potential area in the pelvic floor rehabilitation, but more study are required. Thank you very much.